Imagine this scenario. A patient in London is quoted £22,000 for full dental implants. The waiting time is 4 months. The insurance covers only a fraction. The same patient discovers a clinic in South Asia offering the same procedure for only £6,000 with no waiting time, internationally trained dentists, and modern digital equipment. The patient books a flight. This is not an isolated case. This is part of a structural shift in global healthcare. Today, we explore the rise of dental tourism. Why is it growing? Why South Asia is central to this movement, and why this is more than just a cheap treatment abroad. Dental tourism refers to patients traveling internationally to receive dental care, but reducing it to cheap dentistry would be an oversimplification. The global dental tourism industry is driven by 4 structural forces. Let's talk about them. The first one is escalating healthcare costs in developed economies. The second one is globalization of medical knowledge. Third is digital transparency. And the fourth one is mobility and travel accessibility. Now let's talk about escalating healthcare costs in developed economies. In the United States, dental procedures are largely privatized. In the UK, National Health Service or NHS waiting times for complex dental work can be extensive. In Australia, cosmetic dentistry is often not covered by insurance. Patients face high out-of-pocket payments, long waiting lists, limited insurance coverage. This creates a cost-access gap. Now let's talk about globalization of medical knowledge. Dentistry is now standardized globally. Clinical procedures, sterilization standards, implant brands, and digital technologies are internationally aligned. A dentist trained in India or Bangladesh may use the same implant system used in Europe or North America. This reduces the perceived quality gap. Now let's talk about digital transparency. 20 years ago, patients relied on word of mouth. Today, they rely on Google reviews, before and after case galleries, YouTube testimonials, and virtual consultations. Trust is now built online before travel occurs. Finally, mobility and travel accessibility. Low-cost airlines and medical travel facilitators have made cross-border healthcare logistically easier than ever. Dental tourism is therefore not random. It is structurally enabled. South Asia holds a unique position in this transformation. Let's analyze why. So the first of all is economic advantage. Lower labor and operational costs allow clinics to offer competitive pricing without necessarily lowering quality. For example, a dental implant costing $4,000 to $6,000 in Western countries may cost about $1,200 to $2,000 in parts of South Asia. The savings are substantial even after accounted for travel. Now let's talk about human capital strength. South Asia produces a large number of dental graduates annually. Many professionals receive international training or certifications. In metropolitan cities, clinics are equipped with computer-aided design, computer-aided manufacturing systems, digital intraoral scanners, 3D cone beam CT imaging, laser dentistry. Technology adaptations reduces procedure risk and increases efficiency. Now let's talk about language and communication. English fluency across much of South Asia reduces communication barriers for international patients. Hospitality is ecosystem. Let's talk about hospitality ecosystem. Healthcare intersects with tourism. Patients combine treatment with recovery in coastal destinations, cultural heritage cities, wellness resorts, etc. This integrated experience enhances appeal. Dental tourism generates value beyond clinics. Each international patient contributes to airlines, hotels, restaurants, local transportations, medical facilitators, etc. This creates a multi-sector economic ripple effect. Moreover, it incentivizes infrastructural development, technological investment, international accreditation, service quality improvement. Countries begin positioning themselves as healthcare brands. Dental tourism becomes part of national economic strategy. However, rapid growth also introduces complexity. Growth brings responsibility. Key questions emerge, like how are clinics regulated? Are international standards consistently maintained? What happens if complications arise after patients return home? Is continuity of care structured? Sustainable growth requires regulatory oversight, transparency, and ethical marketing. Without these, reputation risk increases. Dental tourism is not merely a cost-saving strategy. It represents global healthcare redistribution, digital trust-based decision-making, cross-border service innovation. South Asia stands at a pivotal moment in this transformation. In the next episode, we will go deeper, examining the competitive positioning of South Asian countries and how they are strategically building global dental brands.